This video will review the Discharge Core Measure Advisor. We developed the advisor because we wanted to hardwire core measures for physicians in a way that fits seamlessly in their workflow. It was important to us not to fire any disruptive alerts or ask the physicians to complete any manual checklists if all core measures had been met. Our advisor operates in the background, and the physician doesn't even see it if they have attended to all the core measures. The Discharge Core Measure Advisor was developed to provide physicians with actionable tools to address core measure gaps prior to discharge. The advisor is triggered by placing a discharge order and reviews the status of 3 core measures: AMI, congestive heart failure, and stroke, in the electronic medical record. Completed measures receive a green check mark, and incomplete measures are flagged red. Physicians can easily complete any missing information directly from the tool, and the advisor has built-in logic to only present acceptable orders and documentation elements. Let's review the key features of the advisor using a clinical scenario. After receiving hospital care, the patient was ultimately diagnosed with an MI and heart failure but did not have evidence of a stroke. We'll pick the patient up when he's ready to be discharged home. Accordingly, we will place a discharge request home. Now, historically, once the physician clicks sign, any discharge core measure deficiencies would be handled in a retrospective manner by the quality department. Fortunately, the Core Measure Advisor enables concurrent review and course correction, as we will demonstrate in the rest of the presentation. As you can see, the advisor has detected multiple opportunities to address gaps in care. Green indicates that the measure has been achieved, and the appropriate reason is displayed in the banner bar. Red indicates that the measure has not been met, and the physician has an ability to click on it to resolve the measure. In addition, the provider has an ability to disagree with the diagnosis, which we will demonstrate later on. Focusing first on chest pain AMI quality measures, we will address the ACE or ARB for left ventricular systolic dysfunction deficiency by clicking on it to resolve. You will see that the echo report is available for review directly from within the advisor. If we click on the echocardiogram report, it will take us directly to the study. In the case where an echocardiogram has not been done because it was recently done in a physician's office or perhaps another hospital and is not available as structured data, the clinician has an ability to manually add that measure, and that will satisfy the measure. In our case, the patient does in fact qualify for an ACE or ARB, and so the physician will place a new order for an appropriate medication to take care of this measure. Note that the advisor will not accept an order for a medication that is not in the correct drug class to satisfy the core measure. When the physician starts typing in a medication from the ACE or ARB category, suitable options will appear on the screen. Once the medication is selected, it will be added to the final discharge medication list, and the prescription will print out for the provider to sign. Note that satisfying the ACE or ARB for left ventricular systolic dysfunction in the chest pain AMI quality measure section also satisfies the same measure in the heart failure quality measures. Turning our attention to the beta blocker prescribed at discharge deficiency, it appears the patient was taking metoprolol in the hospital, but it has not been ordered for discharge. Here, the physician has the option of clicking directly on the hospital medication to convert it to a prescription. The physician has the ability to modify this prescription directly from the advisor. In this case, he's decided to send the patient home on 12.5 milligrams of metoprolol twice daily. Note that the beta blocker prescribed at discharge measure is now met, and the prescription order has printed out on the banner bar. In the case where placing a new order is not clinically appropriate, the advisor enables the physician to document an appropriate reason for not prescribing a medication. For example, in statin prescribed at discharge, appropriate reasons for not prescribing are presented to the physician for selection. If the physician selects other, this now becomes a required field. In our scenario, the patient wants to discuss it with their primary care physician first. Note that the measure has now turned green, both in the chest pain AMI quality measures and in the stroke quality measures, with the reason not prescribed due to other patient wants to discuss with PCP displaying clearly on the banner bar. Lastly, the physician has the ability to dismiss a section if a completed evaluation did not reveal any evidence of that condition. In our clinical example, despite being dizzy on presentation, the patient was ruled out for a stroke. As such, the physician can click Disagree with Diagnosis to remove the section. They'll be asked, are you sure you want to dismiss the quality measure tracking for stroke? In this case, they'll click OK. Note that the stroke quality measures have now been removed. This concludes our brief demonstration of the Discharge Core Measure Advisor. Thank you so much for your time.